of the agenda.
Sure. Okay, well, I have 12 o'clock and we have a quorum.
Hold on just a second. He's still getting it up.
There it goes.
Is it up?
Yeah, you guys should be live now.
Okay, go.
All right. All right, well, hello, everybody. Good thing we're not driving today, although it's doesn't seem to be doing much yet. Gonna get kind of ugly later. Since we have an agenda, let's go ahead and call agenda. We have a quorum. Let's go ahead and call the meeting to order. I don't know if, are we expecting Dr. Behrens to join us, Megan?
I never got a response.
Okay, all right. And I know Dr. Heim, it's just dependent upon her patience. So I'm sure if she's able to, she'll jump in as well. First things first, need an approval of the agenda, or does anybody have any additions or changes? Just the one that we need to note, the error of the year on the top of the agenda, just change that to 2021.
I'll make an approval of the agenda. This is Julie, and we'll change the date to January 14th, 2021.
Right.
I'll second that motion.
Okay, all in favor of approving the agenda with that noted change, say aye.
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 All right. Okay, approval of minutes from the last meeting from November 12th. I looked through, I didn't see anything, but if anybody has any discussion or otherwise.
No, they look good to me. I'll go ahead and make a motion to approve.
Okay.
the minute.
Dean motion to approve.
I
I'll
can
go-
second that motion for the
Okay.
minutes.
Julie second. Okay, all in favor of approving the November 12th, 2020 meeting minutes as written, say aye.
Aye.
Okay. Term appointments. Is this just for information or do we have to formally?
So the Board of Supervisors reappointed on the
Okay.
January 4th meeting. So I don't know that it really needs to be through Board of Health, but I just put it on the agenda so everybody was aware.
Okay,
So I made that recommendation that these individuals be reappointed. I hadn't heard anything that they would not be interested in running again or serving on this board. So the Board of Supervisors went ahead and approved it.
okay. So Julie, is that okay?
Yeah. Megan asked me and I
Okay.
said yes.
Didn't want to put you on the spot, but
No,
we were
no.
hoping so. Okay. Have to do the election of officers for this year. I believe right now I'm chair. I think who's vice chair? Dean,
Art.
are you?
I think Art,
I thought Art was secretary.
oh,
No, yeah, you're right, Art Secretary, and Julie is Vice Chair.
Okay.
was that, okay.
Okay. So if anybody wants to make a motion, make a change, chair position is up for the taking. Anybody can, any of the positions.
You do a great job, Becky. So I'd make a motion just to keep you as the chairperson, and I would agree to be the co-chair or whatever, vice president or whatever. And I can't speak for Art, Dr. Behrens, but
Hey, when you're not here, you get the job.
Mhm. Well, he's lucky because the secretary position here, really, all you have to do is sign it. Luckily, Megan takes that job over for the secretary.
yes,
So.
she's very helpful with that position.
So Julie, is your motion to leave the appointments as they are?
Yeah, I think that would be fine. I'll make a motion to approve everyone's position at this time.
I'll second.
All right. Any other discussion? Okay. All in favor of keeping the officers as stated or as currently are for the next year, say aye.
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 All right, our annual conflict of interest. I think each year I just go ahead and read this to everybody instead of passing around, or if people didn't get a chance to read it. Basically, we just have to discuss this and everybody sign it. The disclosure of potential conflict of interest is a possible or potential conflict of interest on the part of a board member or their spouse or family will be disclosed to the other members and made a matter of record through an annual procedure or when the interest becomes a matter of board action. Spouse, family with a possible potential conflict of interest on any matter will not vote or use personal influence on the matter. The minutes of the meeting will reflect a disclosure. The abstain from voting and the quorum situation. The disclosure of potential conflicts of interest policy will be reviewed by members at the first board meeting each year. The board members will agree each year as evidenced by signature on the conflicts of interest statement. A new board member will be advised of the policy upon becoming a member of the board and agree as evidenced by signature on the conflict of interest statement. So, is there any discussion on this conflict of interest statement or any concerns that anyone has? Okay.
Do we have a record of signatures from the board members on that, Megan?
Yep, every year.
Okay, so we have to sign it.
Yeah.
All right.
So
Well, I'm
I
wondering, I see Heather is on the call. Would it work for us, given the situation we're in right now, instead of everybody signing, scanning, and emailing back, can we send an email that states, please use this as my signature for conflict of interest, or I agree to? Can we do something like that, Heather?
Disclaimer that I'm not an attorney, so I don't know that I can answer that for certain, but I would think if Megan maybe would send the document out in an email to everybody, and then if you just replied back to her email and she could keep that as documentation, and then maybe when you get together in person, you could sign it. But again, that's not legal advice.
Okay. Well, why don't we just, how about, I know that, Megan, that you had that as an attachment to some email, but maybe just if somebody's got it lost in their inbox, maybe just send that separately.
Okay.
And if someone is able to, just print it, sign it, scan it, email it back. Otherwise, just send the reply back saying, use this as my signature for the time being, I would say.
You want us to stop in and sign it? Because I don't have a problem doing that.
Okay. Yeah, if
Boy,
that works.
I would think that if you have a signature from a previous year, that you could, I think an email reply would be sufficient. I think, I don't know. I mean, it's not like we haven't signed it already once,
Yeah.
you know? I would think almost, probably the ones that probably need to sign it would be the board members that are going back on again. You know, I think a one signature should be sufficient for a term anyway, but I don't know.
Yeah, you would think, but just to be safe, let's just go ahead and keep that on file and
All right.
note that we've discussed it and we have no changes to or no suggested changes to the policy.
Okay, I will try to respond to the email and stating that I will sign it in the future if need be.
Okay.
Perfect.
Sounds good. Go ahead and set our next meeting date in March. And
So the Thursdays are the 4th, the 11th, 18th, and 25th.
Probably I guess the 11th or the 18th. Whatever, if there's a overwhelming desire to have one date or the other with anybody.
Both dates work for me.
I'd prefer the 18th of March just because I work that day and I don't the 11th, but either day is okay.
Okay. All right, we can set it for the 18th. Just knowing that if the Hawks are playing at noon on that day, there might be a conflict. So
Well, they could be.
they could be, yeah. Who knows what the tournament's going to look like this year, but that
I
should
don't
be
think I don't think it's going to be Iowa State this year.
I am thinking you're right. So, all right, we'll do March 18th at noon. And assume Zoom unless a few weeks before we determine that we can do that in person. Okay. All right, let's jump in. New opportunities.
Good afternoon. I just wanted to provide a quick update. So we were notified on Friday that they extended the national emergency declaration, which basically allows USDA to extend our waiver, which is the waiver for physical presence at a WIC clinic. So we are still operating through either telehealth or just through phone calls with all of our participants. So that waiver was extended now through May 20th of this year. I was just trying to think, I think I can officially say we have all of our WIC staff with their first round of vaccinations, which was very exciting. And thanks to our public health partners for letting us get that round with all the medical professionals in the county. So once we're fully vaccinated, I don't see any reason why we wouldn't going back to just providing clinic services. So we're probably, I don't know, maybe 6 weeks out from doing that. With that being said, that would maybe get us to the early part of March. And with that waiver in place, we'll still have participants who are not interested in coming to clinic because they won't necessarily be vaccinated. So, they'll still be given the choice of what is in the best interest of their family before we schedule them for an in-person visit. Still doing our monthly family planning clinics. I think I mentioned before, those have been ongoing since the pandemic. Those are, Title 10 was required to operate full services during the pandemic. So we have continued to offer clinical services in person every month since the beginning of this, which is hard to believe we're going to roll upon a year of this sheer craziness. So, and then the only other thing I wanted to update is, because I think sometimes I miss this, but all of our services that we provide through the schools, we have actually had been lucky. We've had the opportunity to continue to provide all those services, and those fall within our Community Adolescent Pregnancy Prevention Grant. So we have a health educator that's been in all the school districts. She was actually face-to-face in all of them, except for Glidden. Glidden was the only one that wanted it through Zoom. So she's continued to provide the curriculum-based education. And that's really around healthy relationships and pregnancy prevention. And then we've also been able to do all of our sealant clinics. So far, all the schools have agreed to let our hygienists in and operate as normal with our sealant clinics too. So Manning and Coon Rapids are actually done for sealants. We'll be doing Fairview soon, and then Glidden's not actually eligible just because their free and reduced rate isn't high enough. But just wanted to mention that we are still in the schools and functioning as normal. So that is just my brief update for the day. If you have any questions or anything. Thanks for the COVID shot, Sarah. I have no extra limbs, no funny shakes in my body, and I'm perfectly fine.
All right, great. Anything else from new opportunities?
I will just throw out real quickly, we just received our community assessment workbook for the integrated provider network. So we are putting data in all the data tables, and we'll be sending out some information on upcoming community meetings to look at some specific data points and start answering the question, why are these things happening here? So once we get those meetings arranged, we'll get some information sent out to you all. And our tobacco grant is up for competition, and that's due Tuesday of this coming week. And we are still providing substance use treatment and problem gambling services. We're able to do some telehealth. People can also come in if they need to, and we just keep plugging away. So thank you all for what you do. If you have any questions, let me know.
That assessment that you're talking about, is that something new, or is that?
Yep, so we are following the strategic prevention framework. It's a 5-step process that SAMHSA has laid out for us. And so we had this past year completed a bunch of community readiness surveys. This is the next step of the assessment phase and looking at community level data. And we'll be doing that in each county that we serve. So this, honestly, when we get around to the next round of China HIP, I will have all kinds of things I can give.
So is it an assessment on readiness for collaboration? Is it like the KU toolbox, or?
We use the KU toolbox on some other projects. So this one, we will be looking at community readiness, and then looking at local data, and then selecting some of our prevention strategies based on the list of available strategies that are approved by IDPH. And we aren't quite sure how all of that will shake out in terms of what will be offered where right now, but we will be providing strategies in each of the 6 areas: information, education, those sorts of things.
So it's not one particular issue, it's just an overall how prevention messaging.
Yep.
Okay, cool.
Yep, so it's our 5 priority areas: alcohol, tobacco, marijuana, problem gambling, tobacco use, and then we're also looking at some meth use data and some suicide data as well.
Okay. All right, thank you. Sarah, nursing.
Hi, everybody. So did everybody get the stats and financials? I think I asked Megan to kind of send them out. Unfortunately, we have not been able to get out in the community as much as we'd like to do the blood pressure checks. Typically, we would go to Hy-Vee and just other places in the community just to do random blood pressure checks, but with COVID, it just isn't a possibility right now. And with our feet clinics that we do, they are kind of on hold now just because of the COVID vaccine clinics that we're holding to try to get that underway as quickly as we can. So and we haven't been able to get out in the community as much as we'd like, but hopefully come summertime, we'll be out there more. And then basically, if we start looking at, we'll do a COVID-19 vaccine update. It's very slow going. We were supposed to be getting 100 or an extra allocation weekly from the very initial dose that we got. We initially had 800 doses for Carroll County. I did allocate out to St. Anthony Hospital, Manning Regional Hospital, and McFarland Clinic. St. Anthony received 400 doses. The Manning Hospital and McFarland each received 100 doses, and I kept 200. So that was the initial allocation. Then we did not receive anything for 2 weeks. We did receive some more, and we're only getting 100 doses at a time. So they're pretty much, they're gone as quick as we get them, which is great because there are a lot of people in our community and in our county that are excited to get them. We have a lot of people calling in asking when it'll be their turn. It's hard. We're moving through phases. we cannot move through to 1B until IDPH says we can. Currently, that projected date will be February 1st. But again, that's all contingent on how much vaccine we're going to be getting. We were getting numbers. Let me see if I can find it here real quick. Currently, the state receives 18,500 doses of Moderna a month. So that then is spread out to all 99 counties in Iowa. It's not a lot. Currently for Pfizer, the state is receiving 19,500 doses, but all those doses until the end of January are going to the long-term care pharmacy partnership program that is in partnered with the state, and it's Walgreens Pharmacy, CVS, and there's another pharmacy and I can't remember, but so basically as of February 1st, the state will start allocating Pfizer out to the facilities that are able to do that ultra cold storage. We do not have that capability. So my assumption would be we're going to continue to get Moderna. Again, that could change. They can tell us that we'll go ahead and keep it in the cooler that it comes in, and you just keep getting dry ice on it every so often, you know, and as long as we can keep it temperature regulated. When we first did receive the first 800 doses, we were getting 11 doses out of each vial. We just held a clinic yesterday and we were only getting the regular 10 doses out. So we are kind of concerned with next 2 weeks. So starting next week and the week after, we're going to be doing boost doses to everyone that received it the first 2 weeks that we did this campaign. We're concerned that, are we going to have enough vaccine to actually revaccinate everybody if we're not getting that extra dose? So the state is aware of our concern, and we'll see how that works. The state was also holding back an extra 5% of the vaccine in case something would happen in transit, or if somebody accidentally didn't store it correctly right away. There would be about a 24-hour turnaround and they'd be able to get their vaccine reallocated to them. The IDPH did state that they will continue, if something happens and the vaccine is bad, they will still get vaccine to them, but it won't be within 24 hours. They're going to have to wait up to a week to receive the new vaccine if something would happen to it. Currently, we have given roughly between 800 and 1,000 doses in our county. And we are having a town hall meeting. I'm not sure if anybody's seen it. It's on our Carroll County Facebook page. I know McFarland's sharing it. St. Anthony is sharing it. It's going to be like we did, I think we did one in December. It's on this Monday, the 18th at 5:30. It's going to be consistent of Dr. Evans, Dr. Collison, Nikki Schwering, and myself, and then Dr. Uveling. He will be the moderator again. So I know we do have a link out there that people can start sending questions in, and we're going to answer as many questions as we can. The main focus of this town hall is going to be on the vaccine. So that's coming up. Our current state with the COVID-19, we are at 15% for a 14-day positivity rate. That is so much better than what it was back in November. And I think it contributes a lot to the mandating of the masks. People have done a wonderful job in our county. They're taking it serious. I mean, like today we had, let me just check how many people we did contact tracing on. We had 7 people today. Those are great numbers. I mean, people, they're really following the mitigation efforts that we're putting out. They're wearing their masks, they're social distancing, good hand hygiene, staying home when they're ill, staying home if they've been exposed. I think that has a lot to do with it. And I also think, and Dr. Hein, you might want to chime in on this too, but I feel that we're not seeing the flu numbers, the influenza numbers that we would normally be seeing this time of year. And I think it's in part of doing all this mitigation that we're doing for COVID is actually helping for influenza too. So if you, Dr. Heim, do you have any input?
Yeah, I will say I'm not seeing any influenza yet. I swab on occasion. I haven't seen anybody that I thought had it that didn't swab positive either. I will say too, even the visit numbers that we have are down. So the percentage of positivity is up yet, but the number of visits that we're getting is down quite significantly compared to the beginning of November. So, we're still getting some, what's interesting is right around Christmas, we had a lot of cases because of the holiday, but one thing I am noticing is a lot of people are getting it, but they can't necessarily trace it back to where they're getting it from. So I think in general, the community activity is low compared to where it was 2 months ago. So I'm very happy with what I'm seeing. I think flu is basically non-existent right now, which is also fantastic. No RSV either. Another problem child this time of year. So that's making things a lot more tolerable, even in the hospitals.
Thank you, Dr. Heim. I guess that's mainly all I have right now. Does anybody have any questions?
Sarah, when you talk about doses, you said 800. Is that considered, when you say dose, is that one shot or is that a dose of 2 shots per person?
That's one injection, yes.
Okay, so essentially you'd have enough for 400 people then with 2 doses.
Right.
Okay.
Sarah, when you were talking about bad vaccine that was mishandled, can you tell by looking at the vial whether or not it is actually okay or not? You have no way of knowing?
Yeah, if I look at the vial, I cannot tell, but there are little thermometers that come within each container, like each cooler that we get. It has a check mark if it's good on the green side, or it has an X on the red side if it's bad. So we're always open for that check mark. So fortunately, we have not had any mishandling or any issues with ours. I do know Crawford County lost some quite a few doses due to the shipping. So I'm not sure on the issue, but if I would guess, I would say it was possibly something to do with the temperature.
Is it overall, have you gotten any feedback from IDPH? Is it just the state of Iowa that seems to be lagging behind other states? Because I have friends in other states that they're like opening it up to the public to get vaccinated. I don't understand why our numbers are so small of the vaccine that was received statewide.
Right. So of course they go off of population, but each state can govern whether they want to just open it up to the public or if they want to follow the phase structure that was either put out by the CDC or the Iowa Disease Advisory Council, which it's IDAC, and that's who we're following. That's who IDPH is following, and that's where we're getting our guidance. I agree. There's a good handful of states that are in their general population now, and they're not following. They're doing what they want to do as their own state.
Okay,
So
I just assumed that for some reason maybe we didn't request as much in our state, but that makes sense.
So phase 1B will be available February 1st.
That's and it's all contingent on how much vaccine we'll get.
Correct. But okay, so what is phase 1B? Is that 75 and over?
Yeah, so currently phase 1B was just revamped. And we're still working out the kinks of it, but yes, it is 75 and older. It is pre-K through 12 school staff, first responders, inspectors responsible for health, life, and safety, including those in hospital, long-term care settings, child and food production safety, and government officials. So they really thinned phase 1B out.
So first responders have not been vaccinated yet?
No, they got pushed into phase 1B. So first responders will include firefighters, police officers, and dependent adult abuse and child welfare social workers. Yeah, so unfortunately they were, I think at one point in that 1A phase, and then they moved into 1B.
Okay.
Sarah, what's been the perception of the public, and Michelle as well, as far as acceptance of the vaccinations? Any resistance from anti-vaxxers or for other reasons?
Here at Public Health, we have had a lot of people calling from all age groups, wondering when it's their turn. We have not had any anti-vaxxers call us at this point. Doesn't mean it won't happen, but a majority of people I feel are, they can't wait to get theirs. And I don't know, Dr. Heim, what your perception is on that.
I would say there's a good number of people that don't want to get it because they think it was pushed out too fast. And I think you're always going to get the anti-vaxxers who refuse to do it because of whatever reason. But I think when they see a lot of the healthcare providers getting them and getting their doses and doing fine, I think that's encouraging for a lot of people. So I think a lot more people are getting more comfortable with it. So I think some people just don't want to be the first one. I did. I wanted to be the first one. But I think once they've kind of gotten used to the idea that people are tolerating it and doing fine, I think people will embrace it a little bit more. But to be honest with you, I haven't had a lot of, the patients that come into the clinic aren't necessarily as negative about it. It's more people I talk to, just acquaintances and things like that. They're not necessarily like, this is stupid, or you don't want to do it. It's more, I think I'm going to wait a little bit. They're just a little hesitant to be at the beginning. That's just kind of my feel.
Okay. Yeah, one thing I wasn't aware of, and just talking to people at church, was the concept of the fetal cell line being used to develop the vaccine. And so I've been hearing a little feedback on that, as far as a little resistance, which I never even thought of that till they brought it to my attention. So.
Now, I'm not 100% sure on this, but I'm pretty confident that both the Pfizer and the Moderna, neither one of those did use any of that in their studies. And I don't think any of that is used in either of those vaccines.
Well, that's kind of what.
And the bishop did, and the bishop did send a clarifying remark on that people shouldn't feel hesitant about getting it. So I know there was information that was sent out from the bishop on that. Still encouraging people to get the vaccine. Yeah.
And the Pope is getting his vaccination today or this week.
Mm-hmm.
Right.
And
yeah,
I think it was, what I heard, it was AstraZeneca. That one is the one that is using fetal material. That's what I had heard.
Yeah, they were trying to show me sites where it was online that I think Pfizer and even Moderna, I thought, had used it in the development stage or testing stages a bit. So,
but yeah, I
don't know what to believe.
Recommend if anyone there, the bishop, the Sioux City bishop, has a statement on it. So that would be, if there was concerns, religion related, I would go directly to. I think they put it on the faith, or maybe it was in Lumen Notes, but I know that the bishop specifically addressed that concern.
Right, and also the Pope was suggesting people get vaccinated for it as well. So,
Yep.
But that doesn't stop some of the skepticism locally, I guess.
Right. They just need to be pointed in the right direction. There's always going to be negative things online, and that's why, if this is based upon a religion or religious concern, then go to the religion source. And for here, I know I saw that from the bishop. I know it's out there. So,
Yeah,
okay.
I actually have a letter from the bishop that was forwarded on to me by Dr. Yuveling. So if I can find that, I will send that to this group for that. So I got to dig through some emails, but I'll see what I can find.
And I can
That'd be
look too,
great.
because I'm positive that I saw it and I thought, oh wow, well this is, extraordinary. So
Yeah, I had one person send me a clip of a gal that worked as a kind of a geneticist or a researcher that worked in a lab, and she was pretty convincing that they had used it. It was from fetal cells that were gathered in 1970s, but they still continue to gather because it takes they need to continue to kind of refresh that cell line a bit, so they still continue collecting some cells yet. So, but she was very convincing.
yeah, there's a lot of that stuff out there. So we'll find that note from the bishop, and hopefully that should clarify it for anybody that has concerns for that reason.
Yeah, and if I can figure out how to forward that clip, I might do that as well. So.
Okay.
Becky,
All
can I
right.
just ask a question of like maybe Sarah Michelle to answer? What is the recommendation like for our pregnant women and like breastfeeding women? Because that's definitely come up with us, and we've generally been telling them to contact their regular provider for guidance on that. Does that sound right for us to be with our WIC moms, or?
I would absolutely defer that to their doctor.
Okay, thank you.
Becky, before we get off of the COVID-19 thing, can you give us an update on the contact tracing or what you know about it? Or maybe Sarah, you as well?
I'd probably defer that to Sarah. I mean, the numbers have been much more manageable. Charlotte and JJ have been doing great, I think, from an outside perspective. I know I haven't had to pitch in to do any because the numbers have been so manageable. I know Sarah Anderson hasn't taken on anything extra. Megan, you haven't had to jump in there since probably beginning December. Is that sound about right?
Yeah, so I mean, it's been a while.
Yeah. So, and I don't know, Sarah, do you want to speak to that?
Yeah, I agree. But again, I'd like to reiterate that our contact tracing is only as good as our case investigation. So if our patient does not tell us who they've been in contact with, we can't contact anybody. So I agree. Charlotte and JJ have been doing a phenomenal job. They've pretty much been able to handle it on their own. Sometimes we'll jump in, or I'll do like the Sunnybrook, or if there's anybody in assisted livings or long-term care facilities, we'll try to help out. But they have done a phenomenal job. It's very manageable. I would say the last time everybody was doing it would be November, December timeframe, when probably everybody was doing at least 10 plus patients a day. That was when it was the highest, but yeah, I think it's manageable and we're doing great.
Hey, Sarah, can I just give you one little feedback while I'm thinking about it?
Absolutely.
So I have one little concern, and that was with some of the new recommendations. So I routinely am telling people anybody they were exposed to needs to stay home for 10 days since their last exposure. I have had some people say that public health has told them, well, if they come in and get a test, as long as it's, within that 48 hours before day 7, then they go back, which is technically a good recommendation. The problem is that I think people are running pretty loose with that recommendation. I'm seeing them like on day 3 because they have a scratchy throat. And so then they think if they come back in a couple days and recheck and it's still negative, that they can go back. One of the problems I see is that our rapid test is not considered effective for people that are asymptomatic. They're supposed to be having symptoms. So I think I'm a little concerned about people getting a test on day 5 that's negative and then going back on day 7 without a lot of guidance there. Because for one thing, I would probably recommend they get a PCR done and not a rapid test, because I don't think they're super accurate. So I think that might be kind of a gray zone that maybe you want to discuss with some of the people that are doing the contact tracing. Because I've had patients come in and I usually tell them, frankly, I'd rather just have you stay home the 10 days or get a PCR test because they're more accurate. And then by the time you get that done, it takes too long anyway, and you're already there for 10 days. So I think that we got to be a little bit careful sending people back a little early. It's my only concern. Oh, I froze up.
So I guess here's when hear me now. Can you guys still hear me? My internet's being weird.
You're going in and out. You got a little glitchy.
Okay. Well, so basically when I'm called to talk to people to do the contact tracing, I do explain to them that yes, the 7-day, but that St. Anthony and McFarland Clinic do rapid tests, but only for symptomatic people. So they're going to have to sign up through Test Iowa, and they cannot get out of their quarantine until day 8. They have to be asymptomatic, and they have to wear a mask through day 14, no matter what activity that they're doing. So that's the guidance I'm giving them. And I don't know, Dr. Hein, would you rather us just not give them the 7-day option anymore and just say you have a 10 or 14-day? Because I do know, I'll explain that to them too. I'm like, well, when you go to get the PCR, it's going to take a day or 2, maybe 3, depending on when you get it. And it's going to be day 10 anyway. So you might as well stay through day 10. When I talk to people, so do you think we should
I think you just have
get rid of 7 days?
Well, I just avoid it in general. I don't really give people that option because I think people don't understand how they need to do that. I do tell them that, but I tell them it's a lot of hoops to jump through. But I think the difference is that a lot of them are going to get these rapid tests wherever, and those are probably antigen testing, and those are not effective unless you get them within, day 1 through 5 of symptoms. So, we use them in the nursing home with the understanding that they're getting them tested frequently, and that if they come back positive or negative and they're having symptoms, then they have PCRs to back them up. But I think a lot of people are running fast and loose with that recommendation. And I think that may be a huge area for exposure if people aren't getting PCR testing and going back too soon.
Well, I thought I was under the understanding that you guys don't use the rapid test if they're asymptomatic. Is that right? Or are they just telling you they have some weird...
Yeah, I think so. People get a scratchy throat as soon as they know they've been around anybody that's had COVID. It's kind of like an itchy head when you have head lice. It's kind of just like, oh my God, I've got it. So I see a lot of people that way. And most of the time, I think they feel fine. That's just their way to kind of like get in the door, and then it's negative. And I'm like, you realize you have to be without symptoms to go back at day 7, not just a negative rapid test 2 days before. But I think it's, I think that the rapid tests just don't have a lot of validity if you're checking them on day 5. That's all I'm saying, really. If they're not having symptoms, that is.
Okay. Okay. I can talk to our tracers and just let them know. We do have a 7-day one, but you got to jump through a lot of hoops with it. It's easier just do the day 10, continue wearing masks through day 14, or you have the 14-day quarantine rule, because DHS, they only allow the 14-day. They won't allow the 7 or 10-day. So that's another thing we're getting issues on, is we have parents that get upset because now this kiddo can't go back to daycare because they are following DHS guidelines, and DHS says it's a 7-day or it's a 14-day quarantine no matter what. So I've had parents call and say, hey, I'm confused. Why is this? So I'm like, well, the daycare you go to, do they follow DHS rules? If so, this is why.
Gotcha. Yeah, I think, if you're going to tell people to get testing, like just have them plan on day 5 going to test Iowa and not going to Fort Dodge to get their rapid test, because it's fine if they're doing a PCR, because a PCR can pick up a positive or a negative in somebody that's asymptomatic. Whereas, yeah, my rapid test could, but it's really only sensitive if you're producing antigens. And if you haven't started producing enough antigens, then I'm not going to get it on a rapid test. So I think if they're going to recommend that people do that 7-day, make them just realize that it should probably be a PCR if you're going to do it before that day 7.
Okay, well, thanks for bringing that to my attention, because I didn't realize people were trying to find a rapid test somewhere, because I always tell the ones I call, you have to go through Test Iowa, because nobody else will do
because I've just had a few people kind of, even just people in the community, like, you know, I'm on a group chats for different like basketball teams or volleyball teams or whatever. And it's like, ooh, you got out of your quarantine with a rapid? I don't know about that one.
Yeah. Yeah, I guess I was thinking everybody was doing a PCR.
Yeah.
Boy, I guess
I think
I
if
was
people just
wrong.
know the difference there, then that might kind of solve some of that problem.
Okay, we'll kind of change that up a bit.
Perfect. Thanks.
Thank you.
And before we get off of the COVID thing, I don't want to take any more time, and we don't want to necessarily debate this, but the board members can get back to me via email, or you can call me. But during the time when this contact tracing was a real problem, back when public health had it and then went to IDPH, and then the determination was to take it back to the county. Becky Benami put a lot of time into that and gave us a lot of great direction. And it's turned out to be a very positive thing. And at that time, her and I visited a little bit about this. Becky doesn't know I'm going to ask this, but I guess I would like to see the board recommend or approve a stipend for Becky for her work done on that. It can be paid out of the COVID reimbursement program that we're having. You know, so if you want to get a hold of me and talk about that, Becky, if you've got any comments on that, you can make them as well. But I think that she really deserves. She did a great job.
Thank you. But boy, this was the weight of the world was on Sarah's shoulders, though. You know, Sarah and Nikki, and I hope you're feeling a little lighter. Or I know with all the vaccinations that are ongoing, but do you feel like you see a light at the end of the tunnel?
I do, and yes, thank you very much for all your work in getting this started. Definitely feel a weight off my shoulders, and so does Nikki. We can focus more on what we need to do now with the vaccines, and we don't need to focus a majority of our day just in contact tracing. So we greatly appreciate everything that the board has done for us here at Public Health. So thank you to everybody for approving it, and Becky to help spearhead this. So we appreciate it.
You got a lot of work ahead of you yet, Sarah.
We do. We got a team over here getting it all figured out.
Okay, that's all I have.
Well, thank you, Dean. I appreciate that. And, you know, obviously I'll leave that up to your decision. I would abstain from any discussions on that, of course. So,
okay.
All right, environmental health, Carrie.
Right, so did everybody get my emails with my attachments? Okay, so since you've had a day or so to look everything over, was there any questions about the monthly report for November and December?
I just saw your one statement there that you had to investigate businesses for allowing sick people to come into work. Was that quite a few, and is that getting better?
I received 2 calls about why are we allowing these people to go back to work when they are positive for COVID. So since Sarah gets involved with that also, so I guess more than anything, I was just letting you know that I was getting calls about businesses locally that were supposedly, we don't have any definite proof. I know there was some contacts made to managers to make sure that these businesses knew that they were not supposed to be allowing these people to come back to work. But yes, those calls were being made to us, and I'm sure Sarah was getting those. I know Sarah was getting those calls also. Did that answer your question?
Yeah, that's fine. That's fine. Are you still receiving calls like that, or is that?
I have not.
Okay.
I have not.
Sarah, are you?
Not for a while. No.
Okay. Okay, good.
And Carrie, do you want to expand? I mean, you basically, some tips that were pretty credible, you tried to forward on to the state, correct?
Yeah.
But there what?
We made contacts to the state, and I know OSHA had been contacted also. I guess that we don't really get any follow-up on what the outcome was, so I can't give you an outcome. But I know that there were contacts made beyond the county in trying to get these businesses to follow the rules and the recommendations about employees.
I can tell you just from kind of some experience, because I'm pretty confident our clinic might have reported something. We actually had a business that was strongly encouraging people not to get tested, even when they had positive family members at home. And then we kind of complained and did some things up the chain. And then after that, I saw several employees that came in from those places, and I think they changed their attitude a little bit.
Okay, sounds good.
So are there any other questions about November, December? Okay. Another attachment were my claims from December and January. Are there any questions about those? If not, I'd seek to get approval for December 2020 and January 2021 claims.
Anybody want to make a motion to approve the claims?
I'll motion.
Okay, have a second?
I'll second.
Okay, got a motion and a second. All those in favor of approving claims from the last 2 months, say aye.
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 All right.
Okay, so then I've attached, it's budget time, and we're down to about 8 minutes before the end of our hour. And Megan hasn't even gone yet. So I've attached the financial report from 1920. That's on there. The number, I mean, obviously 1920, we're talking starting beginning of the COVID until June, the end of June. So there were some monies that we were not able to get revenue because things shut down. So that total tax asking number is higher than I would like it to be. So is there any questions about 1920 before I talk about 2021 and go into the budget for 21-22?
No, I'll just say that Rich Ruggles and myself reviewed Carrie's budget for 2021. We understand that there's a lot of unusual things going on here. Her spending was for 20 was her income, her revenue was down, but also her expenditures were down as well. Correct, Carrie?
That's correct.
And so they, it's going to work out, but it's just not the same, because of the COVID situation.
So I should have attached 20 where we currently stand as of December 30th of 2020. Did you get that one? I've highlighted a few things, and I can go through each of those specifically. I made myself notes. But where we are 31/20, that's where we currently stand. So I highlighted in yellow the ending balance for that end of the year. And then the revenue or the expenditures is the same. The areas where I highlighted in pink are areas we have not spent any money out of those line items yet. Some of them we may not spend out of at all unless we actually have a need. So I've made it a practice that we don't, just because it's in our budget, doesn't mean we have to spend it. So
Right.
if there's money that does not need to get spent, it does not get spent and it stays. It does not get used. So the only thing, the last three on the current budget are motor vehicle, office equipment and furniture, and passport expense. So obviously our passport expense is not as high as it would have been had people been able to come in. Courthouse was closed, travel's restricted. So we were not getting that revenue from passport. Therefore, our expense, we probably won't have anything in there. The motor vehicle, I discussed this with Dean and Rich, is the line item where we take $3,000 and put it into a capital account and we build that account up should we ever need to purchase a new vehicle. So I told Dean and Rich if they were comfortable with it, if you all are comfortable with it, I just will not pull that money out of this current fiscal year. It's in the budget for next fiscal year, but this year I will just not pull it out, and so that will not be an expense. Is there any questions about any of that? Crawford County contract, we don't request those funds until January, so they're not in there yet. Our pool revenue was down. Obviously pools got closed because of COVID. 2 of them did not reopen. And then the money from last summer went into fiscal year instead of last fiscal year. So if you go back to 1920, the pool revenue looks bad because all of the revenue is sitting in the 2021 budget instead of the 1920 budget. So it all ends up being timing as to when we get those checks and when we get paid. Septics, we lost our perk test person about April. We did not replace him until October. And so he was not able to get out and do a whole lot between October and the time we stopped doing perk tests. But he's back for spring of 21. And so we'll get that back up also. The annual septic inspections, there's nothing on the 1920 budget as revenue because it's all in 2021. So when I do those inspections again in March, April, it'll probably end up either on 2021 or it'll end up in 21, 22. Again, that's all dependent on when the state issues those checks and how behind they are. Tanning and tattoo inspections, we're down on that because all that was closed down also because of COVID. So passport I already talked about. Emergency management, we get that money later to the later half of the year. And well testing and well plugging, the current fiscal year 2021 has 2 quarters from 1920 on the 2021 budget. Normally we get the 4th quarter on as our first payment in the 2021, but we've got the last 2 quarters on 2021. I don't know. Again, it comes in when it comes in. So any questions about the current budget before we move on to next year's budget? which I haven't changed a whole lot. Nothing?
Oh, I'm fine.
Okay.
Go ahead.
So if you look at fiscal year budget for 21-22, it's a 2-pager. There were a few things that I lowered. I did increase the passport fees because we've been getting a lot of people who want to travel. So I anticipate the explosion of traveling once people are able. I mean, we've got people who are traveling in March. They're going all over the place in March, and they're trying to get passports. So I expect the passport revenue to be higher for next fiscal year. And then under expenditures, really the only thing that's changed are salaries. That was approved by the Board of Supervisors at 2.5%. And the insurance is also a 2.5% increase. I raised postage a little bit because if we're doing 4 passports, then the postage will go up. We have had issues with passports. We've had 2 passports that still, after 3 to 4 weeks, have not made it to the U.S. Department of State because of the U.S. Postal Service. So we have actually recommended to several people in the last week that they use an express mail service, which is more expensive than what we were using. But it's got a guarantee to be there within 2 days. And if it's not there, then they get reimbursed those monies. But if we have people traveling in March, and sent their passport in 4 weeks ago, and it still takes 4 to 6 weeks for the U.S. Department of State to process that after they get it. So I'm not sure what's going on with the U.S. Postal Service, and hopefully it's just an isolated incident, but we have had issues with the mail. And so our postage costs potentially will go up because we want to make sure that those passports get to where they're supposed to go in a timely manner. Other than that, everything is basically the same. Is there any questions about the budget?
I didn't see anything.
Just one question, when you go to the speedy delivery, that you also charge the client for that as well, right? So that
Yes.
extra expense is going to be covered.
Yes.
Okay.
So we need a motion to approve Carrie's budget.
Yes.
Yes, please.
Anyone like to make that motion?
I'll make the motion.
Okay.
Okay. Art, I'll have you make the motion. Second.
I'll second the motion for the budget for 2020, 21, 22 budgets.
All right. All in favor of approving the budget as stated from environmental health, say aye.
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 Okay. No objections. All right. Anything else, Carrie?
Nope. That's it.
All righty. Thank you. Megan.
All right, I sent an email with all my attachments. Hopefully you got it. So I had the November, December reports and claims. So any questions on those, or I will need a motion as well to approve those.
Just one question, Megan. Your December numbers, were those fairly average for regular years?
December, as far as, are you
Like
talking
your
about?
client numbers and hours and,
So, I mean, I think overall, the client numbers have been down a little bit from past years. We kind of dropped from, we were always like around that upper 90s mark, and now we're down in the 80s. So maybe a little bit, but
nothing too
Nothing.
considerable then.
yeah, nothing that things change frequently, it seems like. COVID it's been weird with us because we lose some because of COVID, but then we've gotten some like short-term ones, like through with Carroll area nursing, just because they need that extra assistance to kind of recover. So it's been a weird year, as with everything else.
Okay. If anybody has any questions, otherwise we would need a motion to approve the claims, approve payment of the claims.
I would make a motion to approve the claims.
Okay, and I will go ahead and second that. So all in favor of approving the claims, say aye. Aye.
Aye.
Aye.
Okay.
Alrighty, the next is my 21-22 budget. So that was 2 pages. The top is the revenue line, bottom portion's the expense line. Really not a whole lot has changed. My revenue line, I did drop there just a little bit. It's just hard to exactly predict or project what we're gonna for sure get. So that's down just a little bit from last year. And then as far as on the expense side, so the 2.5 for salaries and 2.5 for insurance. And then all of my other expense lines, they all stayed the same. So none of them raised or anything. And then I kind of put at the bottom there the difference from last year to this year. So overall, the tax asking is less. And that's due to just like with two employees who get the free year of health insurance after retiring. So that falling off, plus a little bit less salary because when I rehired, just hired at a lower salary. So so not a whole lot of changes with my budget, I guess.
Your budget has been a little bit more predictable. Your makes it different than Carrie's, which is pretty unpredictable. And so yours is a little bit more in line with what you normally do, correct?
Right.
Yeah.
The revenue side is just sometimes you don't know for sure. I mean, but we're usually pretty consistent, so.
Anybody, any other questions for Megan on the budget? Any concerns?
The Board of Supervisors also did a pre-budget meeting with Megan and found no concerns either, so.
All right, well then, why don't we go ahead and if someone wants to make a motion to approve the budget?
I'll make a motion to approve the budget.
Okay, Betty with a second.
I will second.
Okay, all right, all in favor, say aye.
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 All right, motion carried, budget approved.
All right, so the next is the annual policy book review. So that's, I have a paper that just, since we have, home care has their own set of policies for different things. Every year, the board just essentially approves that. If there was any changes for the year, which there were, I made no changes. This past year, everything's the same. So if, you know, if you're okay with that, I'll probably just, Becky, since you're the chair now, send this form to you then to sign if that works.
Good. That sounds good.
The form that the policies, you know, were revised or reviewed and is what the form
Yeah,
says.
as long as there's no changes, so.
Yeah, no changes with any policies this past year.
All right, sounds good.
Okay, so I will send that to you. And then the skilled nursing contract, so every March is when that renews with Carroll area nursing. So I have it printed off and usually, so in the past Becky has signed it as well, just whoever the chair is, for the new year, which starts March 1st of 2021. So as long as you guys are still on board that we continue that with Kean's, Carroll area nursing, sorry. And I'll have Becky sign it again and then send it over to them.
That sounds good, unless anybody has any objection or discussion or questions.
Sounds good.
All right,
All
so I will send you that as well then.
Good.
And that's all I have.
All right. Great. Anybody else have any final questions, concerns?
I will just say that, you know, as everyone knows, the Board of Supervisors did extend the mask mandate. We don't like to call it a mandate because we don't necessarily know what it is, but we did we did extend the resolution, I should say, I guess. We think it's been very helpful, and this thing is not over by a long shot, and Supervisor Miners and myself wanted to extend it at least 60 days into March 15th, but we met with some resistance there. So we did extend it to February 15th. So when that comes about, we'll see what it looks like. But once again, Becky was very instrumental in helping us get that measure through the first time in November with good data. She did a very good job of putting that together. So we got to thank her for that. And we were able to get another 30 days squeezed out of these guys, but I'm not sure what it's going to look like, you know, in February. So keep aware of that. And if anybody has any questions or what we can do to support another 30 days or 60 days, whatever it would be, we would probably appreciate that. So.
Well, Dean, my thoughts are that after Biden is inaugurated next week, you know, he's been saying for quite some time that he wants to have 100 days of masking. So I'm guessing that there'll be some national changes within a couple of weeks, and maybe you know, that will be the direction that we're all looking for locally. That you know, that then we just fall in place with a national recommendation or mandate or whatever it's going to be. So it might take care of itself. But if not, then we definitely will have to revisit, you know, the beginning of February because especially as slow as the vaccine is to get to our state, I don't think that, you know, middle February would be an ideal time to lower the guard.
No.
Okay, well, anybody else have anything? All right, well, then let's go ahead and get a motion to adjourn the meeting.
I'll make a motion.
I'll second it.
All right, got a motion and a second. All in favor of adjourning the meeting, say aye.
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 All right.
Stay safe,
okay.
everyone.
Yeah, I'm looking
Yep.
out the
Thank you.
window and it's really snowing quite a bit right now. So I can't see too far to the west. So
Heather, you've been pretty quiet. How are things going in your neck of the woods?